So facelift philosophies I think are important to be able to convey as the surgeon. Basically my basic philosophy is to have really happy patients, and that's my desire. So there's a flexibility around that in terms of trying to meet the needs of the individual. But you've also come over time and experience to believe what does well, what doesn't do so well, and to kind of be able to communicate or convey what we're about. So in general, there's a gender difference in facelifts. And none of this is specific or meant to be in any way gender negative, but when I see men who look great as they age, they look their age, they just look really good for it. So my philosophy for men in terms of facelift is try to achieve undetectable surgery and try not to make the man look younger or demasculinise, but to make them look better. And often it means a more conservative approach and not doing things, leaving some ageing and not putting detectable incisions. So none of this is set in stone, individuals vary, but as a philosophy, seeing a man that looks good for their age is good. Women, as a very basic generalisation, look better when they look younger. For them, not for anybody else. I mean, I think there's many, it's very difficult to discuss this without appearing to be ageist, and I'm not at all ageist, where if women age at any age and feel comfortable in their skin, then they should not have plastic surgery. They should just enjoy their happy lives, and that's important. But if people feel as though they look older than they feel inside, and they want to improve in their eyes their appearance, it generally is to look younger. And in general, a younger, less tired appearance is what I find women seek, by and large. Men may seek that as well, but the knock-on effects in men of trying to look too young can be demasculinising, and not every man wants that. So philosophically, if I had to sum it up, in an area fraught with ageist peril, it would be to say women want to look younger and men better for their age. And I think that's a philosophic difference. And when I see a facelift on a man that I think looks obvious, or it generally the man looks feminised, they've kind of had a female facelift that hasn't been understood. And the operation's the same that's being done on them as would be done on a female. But I think in concept and execution, there are significant differences in what we're trying to achieve.